get one usual suspect where they join us for inside studio.
Suspect.
And in a suspect, doctor, you don't talk suspect now. And based on that level, you know, saying body matter we don't carry come. And based on saying a specialist on top woman body matter in a what we call gynecologist and a doctor be that way specialized.
Gynecologist no day for Pidgin English.
You know, now woman, now specialist on top woman body matter.
Okay, that's
now gynecologist be that.
Right.
So inside the last upper week. They get one topic we will carry where they talk about infertility. Now we talk about the one we concern man. And now we go do the one we concern woman. But Dr. Mo will just do small recapitalization on what you been talking inside that upper last week then. We talk about.
In fact, you know, now the thing don't even take small. You know, last week I know get chance come.
Okay.
But here, so you people conveyed my apologies to our own people.
They hear and well.
That day I've been in the theater, so I know don't get chance come. Anyway, my people don't show again. Today being Wednesday, on top of body matter here, we will be talking on Tubal infertility today. But before that, make we have small recap of things we talked last week. And you remember, 2 weeks back, we've been talking about male factor infertility. And that time we hear say, you know, for we country and for we part of the world, if anything there for family, woman no get belly. Now the woman be the only problem. And that day we be here say 40% of infertility for family now from the man. So right now the man don't carry the greater percentage. What woman carry for body just be somewhere like 20-25% now. So men need to be investigated. So anybody with their family and picking no grey come. Make you no look at the woman first. Look at the man first.
So now the man will check first.
Yes, before the woman. And the good thing is they say checking for men, you know, they're too difficult like that. They think they're very easy. Take blood, do some few tests, do seminal fluid analysis. We don't finish with that and see what the problem is. And for that, they will be learn say what thing they make male infertility come. Now, two things mainly: inability to produce and inability to deliver.
So production and delivery.
So some people no fit produce quality spermatozoa, and that one be their own problem. And that's a major problem on its own. While some other people, they fit produce, they get the thing inside body, but they no fit deliver. And that one too a major problem. People will get erectile dysfunction, even if they get the thing, they no fit deliver. And for some people again, the two can't join body on top of one person. The person no they produce, the person no fit deliver. That one is very, very complex. So the message be say if you're outside there as man, as woman, you get one issue or the other, please, about giving birth. Let's start with the man first. Plenty may not agree come hospital at all. You go only see the woman they front, only the woman they come. She will come, we go check her, we'll do everything. If we say make the man come, the man will give all manners of excuses. We know say men they're very busy, but we need to create time. Make we come check our body, they're very sure, say everything they fine. And by the time these things are being done, then we are good to go. Today we'll be talking on tubal factor infertility. That is on the side of women. You know, last week we talked about this infertility and a difficulty in conception, where it happen to any family, and it get in own definition. When people they live for family together for up to 1 year and pikin no come, now that one be waiting with they call infertility, and they must be looking for, because some people if it see man they Lagos, woman they Abuja, and they come to say pikin no gree come. That they will talk say pikin no they come by Bluetooth or infrared. You need to make direct contact before this will come. So in that situation, we don't take it so very seriously, because these people know they stay together. So people where they cohabit, they stay for under the same roof day by day, and for 1 year, this pregnancy team no agree come. Then we say infertility don't set in for such families, and we come in to investigate and then be of help to them. For female factor infertility, many things fit cause infertility for women, starting from the brain, coming down to the ovary, going to the tube, even coming inside the womb, and even outside. Many factors can come in from any of these points. But today, we just want to pick one, what is called tubal infertility.
Okay, now as doctor, you don't really talk and say for the women different factors dey, and we will just pick one for only inside one. Today, because it be like as you take pick that one, one long well. But for you to take join us for inside the matter, all you need to do now to enter inside my Instagram at MC Bluetooth Ccfr. We dey live, so if you dey watch us live and direct, and if you dey send your message for there, since our WhatsApp, the head done the touch. So if you just enter inside my Instagram, send message at MC Bluetooth Ccfr, why Dr. Sam Joe dey inside studio. If you dey watch us there live and direct, we will put enter inside this short market. When we come back, now tubal infertility, we dey talk, and this one now concern the woman. We don't talk man own. Now, women know, carry on ear put now, everybody, even the man said put ear, because that last week now women and then they put ear pass, they ask question. So inside today, everybody see put ear. We they come back now, no touch that. Yes, so we don't take show back live and direct, and I repeat the thing for here. It's in a little Ronto, we just join us, little Ronto, we join us on top Instagram live. So if you enter Instagram live, they watch us, and if you say they drop your own for there at MC Bluetooth Ccfr. More with the reason this matter together. But inside today, it's a tubal infertility. That are the factor we concern woman now. We concern infertility.
That's the tube. You know, last 2 weeks ago, I've been saying this.
More don't call on last week.
last time.
We are last time. Last time.
This tubal infertility or tubal blockage, they happen even in men. So it's not only women that could have problems with their tubes, even men too fit get problems with their own tube. Men, they outside there where their tube don't block. And what that one mean, they say they no fit deliver, even if they can produce. And that is an issue on its own. But for the side of women, many things fit happen with the tubes, starting from those who no get tubes at all.
So people there where they don't get tube?
Completely. Congenital absence of the fallopian tube. You go do everything, you go check tube, no, the whole place is just blind. And what that one means, they say there's no communication between where the egg day and where Pidgin supposed to stay inside womb. So ordinarily, humanly speaking, waiting for the natural conception, it won't happen because the tube is completely blocked. There is no communication at all between the ovary and inside of the womb. For some other people, their tube they unnecessarily long.
You may say maybe if the normal tube supposed to be like a straw.
Yes.
Their own now could be like hose where they used to wash car.
Correct. Very long, unnecessary and unusually long. Waiting that one means they say those tiny spermatozoas, the distance they cover in traveling, though if you look with your eye, it's very small, but it's so much to them because they are so tiny. They cover like kilometers traveling before they reach their destination.
So something was supposed to be like 100-meter race will count on
1,000 meter race. And most of these spermatozoas will die before they reach the point they are supposed to go there and then lead to this pregnancy. And that is a problem on its own. That is an abnormality, and that can lead to a lot of challenges. In fact, this one, even if finally the belly sets, the Pidgin usually lives around the ovary to enter into the tube again and travel down to come inside the womb. That journey will be too long. The thing usually takes like 3 to 6 days. But in this situation, it's even past 7 days. And waiting that one mean, they say the Pidgin will get stuck on the way and begin to grow inside the tube. Ectopic pregnancy with that. So some people have this unusually long fallopian tube. But for some other people outside there, the tube they narrow. Instead of the hole today completely open, it's just like half open. And waiting that one mean, they say spermatozoa fit pass through there, but that Pidgin way down from no fit pass through there, and that one too can lead to ectopic pregnancy. Or completely nothing may even happen. And then where they worry us so much is what we call tubal blockage. And that one be the main thing where we go look inside here. The tube, they very narrow, very small structure. They get hole inside. That's where things are happening. But this tube fit get blocked complete. And commonly, it is caused by infection. Though some people, that's how they give birth to them. The tube they there, but inside the whole place they completely covered. No communication of whatever sort, and pregnancy cannot come. Now, in this part of the world, most of the women we get infertility is from this tubal blockage. Most of them, up to like 60%. So most people outside there, if they come, we get this issue, we get this problem. If you check very well, we'll see the tube don't block completely. So we need to do something about that. The question they say, what thing they make this tube make the thing just
block like that?
But I've been talking to some people, that's how they give birth to them. They get tube, but the tube no get hole inside completely. It is blocked, and something needs to be done. But commonly, it's infection. I was coming the other day, somebody was talking about staphylococcus again. that if person get this yesterday night, moving on the road, that if this one happen, na staphylococcus. If person no fit get belle, staphylococcus. If this one happen, I was just wondering within me, where is the whole of this information coming from? Yes, definitely not that.
Just like specificity talk, say typhoid na hunger.
Or some. Really not. This infection, they are caused by mainly two organisms. One of them they call as chlamydia, and the other Neisseria gonorrhea. Chlamydia and Neisseria gonorrhea, these two organisms, once they affect someone, they fit cause the tube to get like wound inside. The thing go come heal and form scar, and that scar go come swell and block the place completely. And these two are the common ones we fit cause this very problem. And that's why anytime we are treating infection in a woman, we must target these very two organisms first. And then when they worry us so much, we say some people fit get this infection, no go show for body, no go see anything. The woman just be like normal person, they work out.
No sign, no symptoms.
No sign, no symptoms, no nothing. But things they happen inside. When you come check later, you notice that tube no define because something don't happen for one place. And for some other people again, they should get symptoms. Abnormal discharge, they get pain in their lower belly, they get fever, and the rest of them. Sign of pelvic infection, they fit get that one too. If woman they get this infection over and over again, it's not a good thing. If you come now, it will affect the tube small. If you treat them fine, it will go. You come again another part small in that order until finally, before you know, the whole tube may be so much affected. So infection generally is what we need to look into very well. And for some people, they fit get fibroids. I've been seeing people before, you see fibroids right on top of the tube, or very close to where the tube supposed to be. So you need to either remove that fibroid if it is in a good location to free the tube, or at times it may be even difficult to do anything. And some people feel get what they call adhesion. Adhesion are like scar. When you cut person's hand, the place will heal and you see little scar there. The same thing inside the tummy. If there are infection, there is wound or anything inside person's belly, if it causes this very scar. For instance, if we do operation for person, let's say 2 times, 3 times, 4 times, some even 5, some even 6. They enter the belly, they do this one. Small scar go deform. Small scar go deform. And before you know, if it affect the tube and just tie the tube completely at one point and even block it. In fact, the thing fit even twist the tube completely. Or the whole inner part of the woman body fit just be blocked in that shape. And that is a problem on its own. Infection fit lead to that one. Surgeries, as I talked, fit lead to that one. And one condition they call endometriosis also fit lead to this very problem. The question now is, if this thing is like this, what do we do? First of all, we need to investigate. We need to check and be sure, say this thing day or this thing no day. One of the common tests we do na HSG, hysterosalpingography.
Oh, doctor have did it again.
Yes, as usual.
Hysterosalpingography.
As usual.
Oh, Lordy.
Just say HSG.
HSG.
You don't do.
Oh Lordy.
So for this HSG, now one specialized X-ray we do. We inject dye to go inside the womb, go to the tubes and spill out. It will just outline the womb and the tube. You see everything as the thing did. If the thing they blocked, now so you will also see this thing no the past. You know, say something is happening somewhere. That is for HSG. It's an X-ray procedure. You come, we do, you go home. Then apart from that, if it carry person go theater, do laparoscopy and dye test. That one we pass the same. We pass a different dye. You have to use a laparoscopy, special instrument to look inside the belly of the woman and see as the dye go they pass, whether the tubes they open or they no they open. When we've done this and we've checked and we see things no too cajat like that. Then we see from what we have on ground, we don't think these tubes are actually open. We could even do scan to check, because as I've been telling you before now, some people have fibroids they fit get. And if fibroids they there, if it make the tube, because of the size, the mass, if it press on top of the tube.
The pressure where the fibroid they put on top of the tube.
Correct. Just the pressure alone fit cause problem. So we check the whole of these things, make we see what can be exactly for ground. After we've checked and we confirm, say this tube, they fine. Some people feel get only one tube with the normal, the other one they blocked. Some get 2 with the normal, and some get the 2 tubes, both of them don't block. So we need to manage them when we see such things. And what do? Plenty things there. where we manage people. But one thing where I must talk to people, they say once tube don't block, we must do some form of surgical intervention. Some will say, one tablet, no, they will give me, I just take today, and everything will just dissolve, everything will just be normal. No. We must go in, we see, and then we do something. What do we do? Simple tubal flushing. Though simple, not they say you go do it for house. You go call somebody can do. You need to come and meet us in the hospital. We get some special fluid, we mix with some drugs, and then we flush. When we push that, it goes, and if the block is very small, let's say like tiny things block.
You go just did your job, move and come out.
If they just push the thing come out and the thing will just open. If you can't do your HSG letter, you will see say that tube don't open. That means this tubal flushing don't do the job very well. But for some people, this one fit no work. If they think they are a little strong, so we need to dilate. We do tubal dilatation. This one too now special investigator will they do test for hospital for theater.
Okay, doctor, you go good more just bar break small.
Wait till we say the market.
Yeah, we go dilate the market and we go check whether the tube from the market to our bank account they open so that the money go enter. But this thing what we talk now for both man and woman, maybe listen. Yes, we don't talk the man part inside last time what we did with doctor when we talk but now we dey focus mainly on the woman. But this tube blockage where doctor they talk now fit affect man and it fit affect woman join. Now why we see the talk say full family put ear on top this matter. In don't talk the factors where they responsible for say the tube go block, from infection to fibroid, sometimes injury we don't maybe the person don't do operation before, or the person gets scar tissue, then I say injury we don't heal. That one say follow joint pressure, or say the tube too long. So all these things are the factors where doctor don't take talk, and he don't really talk solution onto the level of this problem, because they talk say every problem or challenge with the solution they always do. So as we don't take talk, I'm sure people will just shoot ear. For you to put ear and put eye on top, for eye on, you feel enter inside the Instagram and you see they watch us live and direct, and they see people will line up, we just they watch us. Some of them they throw away love they give us as they hear the message with Dr. Carry come now for my Instagram page at Mc Bluetooth Ccfr. Now we see they talk the matter. So if you did there, enter there, maybe they watch us, and you feel see throw away your own question for there, and we go read them. Since our WhatsApp, the head the touch, you be like say you get typhoid. We will come back now. When they come back now and move enter inside market, no touch or die at all. Will they come? Yes, so very sharply, person for inside Instagram say make I pronounce HSG. I no one bite my tongue.
Just try.
No, HSG. No leave it like that.
Hysterosalpingography.
Hysterosalpingography.
Hystero means womb. Salpingo tube. Graphy test.
More leave it like that. More just leave it like that. I don't want to enjoy myself. Hysterosalpingography.
You don't do.
I don't try.
You don't try.
Where are you pronouncing?
What do you talk, doctor?
When you finish me.
When I wait there on another year and we talk about infertility, we don't talk the male factor infertility for the last time we doctor been there.
Yeah.
Now we talk the female factor. But inside this female factor, the first one we will talk about the tubal blockage. And this tubal blockage we will talk, it still concern man, because you as man self, you feel get blocked tube. Definitely. And when we say block tube, we say to say na produce and deliver.
Yes.
To deliver something Congo, you can't be like saying a radar you don't give yourself. So doctor, concerning this matter now, you talk say solution day for tubal blockage.
Yes. Plenty things need to do. I will just itemize them now. When we finish news, come back, we'll talk about them. We fit do tubal flushing, we fit do tubal dilatation if flushing no work, and we fit do tubal surgery. That are operated with the do right on top of the tube. And then finally IVF. Now that one be the final if everyone did not really work.
Finally IVF, and the meaning of IVF now?
In vitro fertilization.
In vitro fertilization.
In vitro means outside the body.
Oh, okay.
So fertilization normally occurs in the body of the woman, but in this case it's outside.
Okay. So when I don't take here, I'm as doctor, don't take break and down, don't they talk about the procedures then, where they ground to take solve this issue, we consign tubal blockage. The solution will go happen if, in case by mistake intentionally you get your tube, say one don't block or two don't block, or it be like say they suspect say it don't block, but you know if you suspect if you never go hospital. So the idea now say go hospital. Oga Madam carry on herself now hospital no far, go there, go ask question. We'll give chance now for Dumbili Keke Obi to take the news. When you take the news finish, we'll come back now. So more than not touch my dial at all. The news now we won't go enter. So Keke Obi, come carry your news matter. Since you just did my body snap picture, you don't know see people for Instagram just they look you. They say, oh my God.
Oh my God, this is like real life. Oh, doctor, if I allow me pronounce that, if they don't say I pronounceable.
No worry, doctor.
Doctor, don't pronounce our son. I hear we are together.
We know what enjoy you doing. We they come back now and not touch your there. No be small something else. We don't take show back live and direct onto the level of the one who don't take carry come. Oga Madam Office today now still body matter. Doctor they here live and direct as they take carry the ministry enter inside the permanent site. Female factor infertility now where we dey and tubal blockage now we talk. But this tubal blockage, as Dr. T talk it concerns
tuber
man.
or tube? Yeah, the same. Tuber and adjective of tube.
My company is tuber of here. Me want talk. But I did from my friend.
You are welcome.
Thank you.
Yeah.
The message I said that she don't go finally, she don't come back. So live and direct that she they take carry the ministry. Doctor, you don't talk say cases they of how they will take care of this matter of this tubal blockage for both man and for woman. But the reason, but this tubal way you talk say it affect woman more. Now wait till you talk.
Yes.
So doctor, now no, we start with one where I want to ask now. You say that length of tube now, because you talk about one of the factors. They get any way that one something feel happen for that one, the length of the tube.
No, that one they difficult to do anything. In fact, if it did too long, we go cut. The part where did too long, we go come out and come join again.
Oh, then that means solution then cut and join.
Solution they do cut and join. The part where the excess you come out and you copy the remaining one together. Something like yes, cut and join. We still do that one.
Oh yeah, now so
generally they say we know too they like make we operate on top of the tube because the tube is very small. It is just like this thing and you get hole inside. And the hole is so tiny, you can't even see very well with your eyes. If you want to do that kind of operate, you need to get operating microscope. That's on a special device you go put for your eye, make you magnify everything, make you see it well. With your koro eye, even the difficult. So those things are very tiny. So if you do one kind of operate like that, you may end up
you just go block and finally.
So most of us gynecologists, we know too they like to operate on top of the tube. But first we dey flush the tube. Simple procedure if we do now, woman go carry leg waka go home. Use some good fluid and then push inside the womb to the tube and it may help in opening. If that one open, as we've been told before, now we dilate. We get one long slender wire like that and tubal dilator, so we go past for theater and dilate the tube gently. And for some people, this one fit work for them. But some older gynecologists still they will like to operate on top of the tube.
Based on experience.
They say this tube don't block, not to go operate. They will get there, everything, sit down, cut the part we no fine, then come join the thing again together. Gently, gradually, meticulously, they will do their own job. But most of us today, we don't like touching. Why? They operate, get small money. The money they fast small because not be my mind. We go sit down for theater for like 4 to 6 hours. If they do one thing, God have mercy on you if the two tubes don't block. So you go look for where this problem is, you go fix this one, finish for the one on the right, go to the one on the left, get that one fixed. It takes long time and it takes some money. The argument they say, why use this money to do something where the outcome no dey 200%? If you do this cancer surgery for women, it's little percentage that to benefit. Possibly 1 out of 10 or 2 out of 10 will finally become pregnant from this. In fact, some of them after the pregnancy it end up in ectopic pregnancy.
Meaning say the picking go hook inside the tube.
Picking go hook for that tube because that operator you operate, the place will start to heal and form that scar again at that point. And it becomes narrowed. So generally, if we see say tube don't block and we confirm, we must do these 2 tests at least to do HSG. hysterosalpingography. You do the X-ray, we will check and see how is this tube like, is there spillage of dye? We can't see dye. Even that time we never finish, of contrast, I mean. We go to the theater and go and do laparoscopy test and check the thing with our eyes, see koro, see nothing they spill. Then we say this tube, the thing don't block. At that point, then we need to do something.
Okay, doctors, you don't break this thing down like this. I sure say some people go to shout, hey, Chineke, me, what we go do? What you go do? Be say you go hospital. You go sit down with doctor, make it explain this thing to you and your husband. Not be say as you don't hear up for Wazobia Fm now, you cause the shout, oh God of miracle, do something new. Now say you go to the hospital, make they explain, give you so you go understand how the process take be. But first now enter inside market. Don't forget say you see join us on top Instagram for here. They see people for here. We see they join us fresh, and they twirly. The topic where we did on top, we see they talk about infertility. We don't talk the male angle. Now that the female angle we talk, and inside this one says he still join the male small because we talk about tube as the thing they take block and as it take affect whether person go get belly or you know go even get belly. Before even the getting belly process, the process to getting the belly now in this tube they take affect. So that na the delivery now waiting it be. So we they come back now no touch or die at all. As I talk that, since we want to do the laparoscopy with the die with the coffee. Now, so we don't take you back live and direct. And inside studio, self, different people don't they ask doctor question. And you waited there. As you don't take the watch us live for inside Instagram at Mc Bluetooth Ccfr, you see decide ask your question. Or Dr. Mo will open phone line.
I think so.
Oh yeah, we go open phone line now. 0946000995, 0709 2222 995 and 08000 2259296242. Person go talk say, Bluetooth, they call them fast. Oh yeah, I'll call them slow now. 0946000995 or 0709 2222 995 or 0709 2223 995 or 08000 2259296242. Now the numbers where they go. Make a pick this call. 99.5 Wazobia FM. What did you? Yes, so good afternoon to you. Where to be your name already? Call us from. Oh yeah, now that Jesus speak more to the matter. Which question you get to ask doctor concerning this topic where we talk so?
I don't know my radio now.
Okay, so now greet you. Just want greet us. We greet you too. We send them. Bye bye. Thank you. So you waited there where you won't call us. Nobody greet you. Won't greet you. Get question today. Ask. I don't call the number. Give you. May you call us. Talk to us sharply. Who did there? Yes, I will help us off your radio first before you start it. You don't off the radio?
No, I don't.
Wait till your name already. Call us from.
My name is Tina. They call you from Guayampa.
Oh yeah, now concerning this topic, who will you talk? Which question you get to ask doctor?
My question is, an excess abortion cause blockage to waiting colon?
Tube, yes, very well. In fact, that's one of the commonest causes of tubal blockage.
Okay.
When D&C is being done, it can lead to infection and the tubes could be blocked. So it's not okay. Most of the D&C people they are not done by the qualified people because the qualified people are restrained. Our laws don't allow. So you just see woman go just stand there, go meet somebody for one small shop, choke thing inside, turn this one, turn that one. Before you know, infection will come in. Very well, very well.
So when I don't take year, I'm all of when I wait there where they shout, go do and. When I don't take year, say now one of the factors where they responsible from infection to blocking the tube through scar tissue. Then are the injuries where see occur. Other ones take follow joint, which if it cause tubal blockage. 99.5 Wazobia FM. What did you? Yes, so good afternoon to you. Wait till your name already call us from. Which question you guys to ask Dr. Cindy here now? Oh yeah, now come for Chukmat about this matter.
Yes, I have almost similar problem, but I would want the first address, please.
Oh yeah, now we'll talk that one later, eh? Just they put here, you go hear them, eh? 99.5 Wazobia FM, what did you? Yes, I bet you go near your phone where move for here you were. Okay, oh yeah, ask your question.
I want to see the doctor one-on-one because exactly what he is explaining, and there's some problems.
Oh yeah, now thank you very much. You go hear something now, eh?
Okay.
Talk to us sharply. Which question you got to ask us, Dr. Day inside studio? So.
Hello.
Yes, so good afternoon to you.
Good afternoon. How are you?
Now the work with you on top, so.
Please, I want to ask doctor.
Mm-hmm.
The fallopian tube, can it cause miscarriage or infection?
The fallopian tube.
No.
Doctor, just wait first before you answer that question. Okay, so that's not the only question when you take it. So that's the only question. Now, doctor, she asked the fallopian tube.
Can it cause miscarriage or infection? No. Fallopian tube, if tube gets problem, pregnancy no go even set in. Talk more of miscarriaging. That's the first thing. And if at all belly can enter, na ectopic pregnancy be that. Infection they make fallopian tube to get blocked. So infection will lead to fallopian tube to be blocked. Fallopian tube blocked, belly no fit come. So not that the fallopian tube problem fit lead to miscarriage. No. If a woman is having miscarriage, that means her fallopian tube is normal because the belly they enter, those they say they know they stay.
So I don't think here. Another person say, please, can ovarian cyst cause infertility or blockage of tube? Now waiting angelic angel they ask for.
Ovarian cyst cause infertility. In fact, some of those cysts they contain some fluid where they inside. When picking don't form, they still they very tiny inside the belly of woman. Those fluids fit come out, just harm the picking, kill them there. And some of them fit even make the woman not to ovulate. So it's very possible. Very possible.
Oh yeah, I'm going to see the open phone line for here. 99.5 Wazobia FM. What did you? Good afternoon. What is your name and where you call us from? Okay, ask your question. Doctor, the inside studio.
In fact, I want to ask. If infection, does this causes blockage of fallopian?
Yes, infection is the major cause.
Please.
Yes.
In fact, can I get your number, please? I want
No worry, you go hear them very soon, and you go hear them. 99.5 Wazobia FM. What did you? Yes, so what is your name and where they call us from?
My name is Mike. I'm calling from
Oh yeah, now Mike, ask the question where you get for mine. Doctor, the inside studio.
Yeah, the question when I want to ask doctor is, if there is a infection,
yes,
and you go hospital for treatment, is it possible that they're not going to see some certain victim of infection? Because I once had an infection and I went to the hospital for when I got there, they prescribed some drugs for me, and I took those drugs. After which, the same way I was feeling before I went to the hospital, I'm still feeling that same way. So somebody now advised me that I should go to all these herbal all over maybe the town. And when you go to that place, they use one particular medicine to test you. And at the end of the day, they will tell you that some infection, there are some infections that those hospitals can never explain. That it is supposed to be orthodox treatment of the treatment that is better. I don't know whether that is true.
The thing they say some infections they where they're difficult to treat, where the organism get resistance to many antibiotics. But the thing they say we have stronger drugs that will do the job. In fact, the major problem we get now is say people no fit do the test or people no fit buy the drugs. Because we could give some antibiotics that could run up to 200,000 to 300,000 naira. So the drugs are there. It's just the will to get things done that may not be there. But it's actually possible. We fit to do tests and waiting they cause the problem we may not even see. It is possible. But to say that it's the people outside there who they carry something, they do scan and other things, say this kind of organism, they no fit treat them for hospital. I don't think so.
Okay, thank you very much, Doctor, as you take explain. For Instagram, for your person type message, you say, how would doctors say infection is the cause of fallopian tube? Yeah, not be waiting in talk. He say infection is the cause of the blockage. Blockage, meaning say the fallopian tube go block. Infection now one of the causes. Now waiting doctor take talk. I beg no misquote waiting with the try talk.
Is the cause of fallopian tube. Oh, this one like that question. If your wife gets fallopian tube,
if your wife gets esophagus,
when she gets fallopian tube, you marry her.
Fallopian tube now part of human being.
Normal part of human body. We get hole inside. We egg they pass, but that hole fit they blocked, and that's the problem.
Okay. So I don't take here doctor. I know say time not today. Again, but what will be your final advice you will give everybody as the matter takes set? So because a lot of people they ask how they go fit a reach, what will happen. But don't forget, say the reason why we do body matter on top of Wazobia FM now say a lot of people don't know what they happen with their body. Most times now what they their mind now they feel say now waiting they happen, but it is good. May you carry your body, go professional when now waiting they study, and now waiting they be professional on top. Like doctor now sabi person professional on top woman body matter. They call them gynecologists, and now why we dey always carry and come make it address issues them when concern this matter. So doctor, what will be your final advice?
So finally, tubal infertility na major problem. Greater than 60% of all women when no fit get belle now because their tubes get problem. And this tubal factor infertility is commonly acquired from infection, pelvic inflammatory infection in women, having discharge, having pains for down belly and some fever. If it's going on over and over again, it leads to the tubes to be blocked, because this tube gets connection with the womb, and womb gets small connection like that with the outside. So if infection is going on over and over again, the woman can have her tubes blocked. And people that do instrumentation, if it go hospital, they say one check inside the womb, they carry something put inside the womb to see what in there. If those things not they very clean, the fit carry some bacteria put inside there, the thing will just enter the tube directly and start damaging. Now, to guide against your tubes, make this thing no day, guide against infection. And if infection comes at all, kindly see your doctor in good time. Avoid procedures inside your womb in the hands of people where they may be specialists for that area, because many things fit happen there, whether it's pregnancy-related complications or whatever it is. And ultimately, this infection, they are gotten sexually. So you must be sexually wise. Abstain. If you don't marry your own, be faithful. If you think says it don't spoil or anything, use condom. When these things are there, then likely these organisms may not be gotten. But these organisms are primarily gotten as sexually transmitted infections. So guard against this, do the best you can. And if for any reason you get one discharge where you don't understand, see a gynecologist, not just anybody, so that we address this matter very well from the beginning. But even if the tube finally can't get problems, still see us. Many solutions they there that we fit bring and then be of help.
So thank you very, very much, Dr. Samjo, all the way from Chiva Specialist Hospital, where they always join us onto the level of Oga Madam Office body matter. Now they ask for a number. We know if we call a number on air. You understand?
Our mouth go block.
Our mouth go block now. Why we know if we call them on air? But Dr. Samjo, they show all the way from Chiva Specialist Hospital, where they can't carry this body matter. Come, Doctor, they get another issue again. You know, based on this infection matter, they get one time where when I been they do test and check up. They get anyone where they come up so more start the treatment.
And you know, usually we open our ears, we look at the time, we make arrangements before we go on. So we have those things in mind. But for now, we've not planned any.
Okay, so if anything, they definitely Wazobia FM will announce and give on more and know how the ministry the team move. Thank you very, very much, Doctor. So you join us.
Thank you very much, Mc Bluetooth.
All the way from Shiva Specialist Hospital as you take carry this matter.
Thank you very much.
Thank you
Very much. Thank you very much.